Her story's turning into gold. She's taking her power back. Yeah, she's on the rise. Strength in her soul, fire in her eyes. Keeping God first, watch her dreams unfold. Her life's a diamond, breaking the mold. Oh, she's taking her power back. Yeah, she's taking her power back. Harmony.
Welcome to 20 Minutes of Simple Notes from Rita. Today, my guest is here to talk medicine. My guest today is a family medicine doctor as well as an emergency doctor, and she's also an author and a minister. She is the founder and owner of Butterfly Wellness Clinic, and she is here to talk to us about preventative medicine and what are the points or things that we need to look for as women when it comes to our health. Please help me welcome my special guest, Dr. Sabrina Echols. Thank you so much for being here with me.
Thank you so much for inviting me today.
You're welcome. So we are talking medicine today.
Yes.
And one of the things I really wanted to talk about is, of course, women and our health. And I know that there are so many things that we need to actually look for, it seems like. So what are some of the things that as women that we actually need to look for when it comes to our health?
Well, when you sent me the topic of preventative medicine,
Yeah.
I got really excited because I am trained family medicine physician from Baylor College of Medicine. And I've been a physician for over 26 years.
Wow.
And so that is one of my really big passions is promoting prevention. And so, of course, when we look at women, we look at, first of all, what age group they're in and what is the most common health issue or problem in that age group. And so, say, for example, if you're looking at 30 and 40-year-olds, I'm making sure that their preventive is, of course, getting the exam every month, once a year at least, getting their blood sugar checked to screen for diabetes,
Okay.
getting their cholesterol checked to screen for high cholesterol, the risk factors for heart disease. And so getting their well woman exam, okay? And so depending on your age, you really have to, the guidelines may differ according to the age group, okay? But I'm really, really, really big on once you hit the age of 40, you need a baseline mammogram, okay? At the age of 35, we do a baseline mammogram.
At 35? Really?
35 is our baseline mammogram. So once you hit the age of 40, we want you to get a mammogram every year. For breast cancer, to screen for breast cancer.
Okay. So the baseline at 35,
yeah.
If you get it at 35, do you have to get it every year or it's yearly once you hit 40?
It's yearly once you hit the age of 40.
Okay.
And believe it or not, so many women still say, oh, well, I had one at 43 and then like they're 48. And I'm saying, okay, well, what happened between the years? Oh, I didn't get one. I was fine. I was like, no, you have to get one at, I thought I could get another one at 50. So you will be surprised at, of course, we have so many different guidelines out there, but the guidelines that we follow, a mammogram screening starts 40 once a year.
Okay.
You can get the baseline at 35. But the screening starts at 40. Now, if you have a family history of breast cancer, your mother, your sister, then we start to look at you no matter what age you are, for genetic testing.
Yeah.
But that's not really preventive. Preventive is the mammogram. Now, 45, we can screen you for colon cancer screening.
I found that out, yes.
Yes.
Because it used to be like, what, 50?
It used to be 50 now for women, and they're just like, what? 45, yes.
Right.
At 45, we want to get you in because we're seeing more patients get cancer at a younger age.
Yeah.
And so the American, I guess, Gastrointestinal Society, they lowered the age from 50 to 45. To 45.
To
Yes.
try to catch
Mm-hmm.
the early.
Mm-hmm.
Wow.
Now, once you get postmenopausal, you're still doing those things I said before, the lab work once a year for the cholesterol, checking your blood pressure, checking for diabetes, your mammogram once a year, colonoscopy. It depends on what the findings are, but it's usually every 5 to 10 years
Okay, good.
for a colonoscopy. Yeah, nobody wants to do the colonoscopy. And preventive, and this is what a lot of women forget, your bone density.
You
A
know, 'cause you
bone
don't.
density, yes.
But at what age should you start having a bone density test?
Okay, so that has changed too. But we started the bone density like maybe in the 50s, like 55, but postmenopausal age. Now most people are waiting to their 60 or 65 years
Okay.
of age for bone density.
Because I know my
Yeah.
mom goes for those.
Right.
So I was wondering about the age. But you know what? I never really thought about bone density. Not for, my age. So it's not even something that's on the radar for me when I think about it.
Right. So many people, they don't think, what are you talking about, bone
Right.
density? What do I have to go do for that? And I say, basically, they're taking an x-ray of your major bones, like your femur, your bones. They're looking at bones in your back. They're making sure that you're not losing too much bone mass that could cause osteoporosis. Because osteoporosis, you could be sitting up, you could be watching TV, and you could just have a fracture. Nothing. You don't have to do anything, and you can have a fracture. And so it's a myth that black women can't get osteoporosis. Yes, they can. Because they're thinking that we usually don't see people in our family with osteoporosis, and it might be because they don't get tested.
Right.
And so many of our people do not go for their preventive exams.
I found that out, yes.
Or take the time to get tested for, their mammogram, breast cancer screening, or diabetes.
Yeah.
And so it's so important for us to get the preventive exams. That's in addition to they have preventive vaccines. So some people, you think it's challenging for me to get someone to get a mammogram and a colonoscopy. What about shingles? Shingles is there's a vaccine for shingles. It is extremely painful. It is extremely painful. I've had grown men come into office crying if they had shingles. So there is a vaccine that you can get. It's a double dose vaccine. You get one, and then 2 months later or something, you go back and get the other vaccine. But shingles, if you get shingles, and that's the chickenpox, by the way, that's the chickenpox vaccine disease that comes from, if you ever had the chickenpox growing up, I had the chickenpox growing up. So that means that if you ever had the chickenpox growing up, that chances of you getting shingles are higher.
Oh, my goodness.
Yes.
What? So at what age should you get the shingles vaccine?
50.
Oh.
50. Yes. Yes.
Oh.
And so when I think about all the vaccines out there, I'm like, let me tell them about the shingles. That I highly recommend it. Because if you ever get shingles, and I'm sure there's going to have people that look on here and say, oh yeah, she's right.
Right.
It is probably the most painful that anybody could ever experience. That rash is painful. And what it does, the virus hides in nerve cells, and it can come out anytime. And so I even went and got my shingles vaccine when I turned 50.
Does it really prevent it, or it just helps with it not being as painful?
Pretty much, if you get that vaccine, you won't get shingles. Yeah, you won't get shingles. There are some people that actually got shingles, and then they went and got the vaccine. And I say, well, there's no reason for you to get the vaccine now, because now you already had an out case of shingles, and your body has developed antibodies to it. There's no reason for you to get the vaccine now. So basically, yeah, it's pretty good. If you do, I haven't had not one person who've had the vaccine actually come out with shingles. So if you do, if say for example a patient does come out, it probably won't be a really bad case.
Yeah.
Right, right. So we have a whole generation that's never had the chicken pox now that's coming behind us. And
Good for
so they got the vaccines maybe in school
Right.
to prevent varicella. The varicella vaccine is actually the chickenpox vaccine. And so they got the vaccine early on to prevent chickenpox. So they may not see as much shingles. Another vaccine that is really out there, there are two types of pneumonia
I've heard about
vaccine.
that.
Yeah. And so this is what I want to say for the audience. If you have a history of asthma, if you're immunocompromised, or you have sickle cell, or any diseases that lower your immune system, you want to go in and talk to your doctor early about the pneumonia vaccine. This vaccine saves lives. This vaccine saves lives. Now, compared to the shingles vaccine, I mean, the shingles vaccine is not going to cause any mortality, but it's going to cause severe pain if you do get the shingles zoster. We call it the herpes zoster disease.
Yeah.
Pneumonia kills. Pneumonia. This is probably one of the death rates of elderly people, like in their 85 or older, 75, 85. We see influenza, flu can cause pneumonia and death, and pneumococcal, which is a bacteria pneumonia. So the vaccines that you go in, you can go to Walgreens, you can go to CVS. The vaccines that you're actually getting at your local pharmacy, they're preventing bacteria pneumonia. Okay?
Okay.
There is no vaccine for say a viral pneumonia except for COVID. COVID is the viral vaccine to prevent pneumonia.
Yeah.
But I would say out of all the vaccines we have out there, I really want your audience to look into that shingles one
Yeah.
and the pneumococcal.
And is it best to, because you mentioned bacterial, that those vaccines they get like from CVS or Walgreens or whatever.
Yes.
So is it something different that we can get from our doctors than what they have at Walgreens or CVS?
Now, most doctor offices, they don't actually carry the actual vaccines anymore.
Okay.
So that's why you see them mostly advertise, oh, come and get your local flu shot, come get the COVID vaccine or whatever at the CVS, the Walgreens, or the Walmarts.
Right.
Whoever has HEB also has clinics. So those are the best places now.
Okay.
Unless you go to like a health screening, like you're at a city clinic.
Yes.
Or if you're at like maybe one of the state clinics or FQHCs, those are federally qualified clinics, they may actually have it there.
Okay.
Yeah.
Okay. That's that's good information, because that leads me to my next question, because you were talking about, I know so many people don't go for their yearly exams for whatever reason. And some of it is insurance. So is there a place, or they can go online? Are there clinics that actually see people that may not have your standard insurance, that may not even have insurance?
Right.
How are they seen?
I see so many people, and that's a really big passion of mine also, is to help people that don't have insurance. And to connect them. I feel like I'm a bridge many times to connect people to the right source, the right people. So fortunately, here in Houston, we have so many clinics that can help you if you don't have insurance. So you have to go look up federally qualified health insurance. We call them, for short, abbreviation, FQHC.
Okay.
FQHC. So FQHCs, these are just telling you the funding is coming from the federal government. And basically, one of the main clinics here, we have Legacy Clinic. You might have heard of Legacy.
Yes.
And they have clinics all over the city, even outside Baytown. They have them outside the city where you can actually go in and they do a sliding scale based on your income, and it's going to be much less than you going to a private office.
Okay.
For example, private office going to start at $200 and $300 sometimes just to do a preventive exam. And so if you're not working, or if you don't have
right.
insurance, or if you don't have a government insurance like Medicaid, then you can go to a clinic like that.
Okay.
Avenue 360 is one. We
Okay, I
actually have
haven't heard of
Avenue 360 at the Fountain of Praise
Really?
Church. It's located at the Fountain Life Center.
Yeah.
And so Avenue 360 has been there for years. And so
didn't
it's a
know
really
that.
great community clinic for people in the area. You don't even have to live in the area. You can go to these
okay.
clinics. You don't have to live. That's one thing I want them to know. You don't have to live in the area to go to these clinics. Then you have city clinics.
Yes.
You have city clinics, which may be a little bit challenging to get in, just walk in. Like, for example, the federally qualified clinics, you can just walk in.
Okay.
You could do one same-day appointment, and they have rapid HIV tests. That means like within 20 minutes, you'll get the results.
Really?
Yeah, within 20 minutes.
Okay.
And so there are a lot of clinics there that you just have to research them. Of course, you got your Harris County clinics.
Right.
Harris counties are state clinics. So
They're funded by the state.
They're funded by the state, and you have to have what you call a gold card, or you have to have access to go to those clinics. So you just can't walk in a Harris
Yes.
County. You can't just walk into Acres
Right.
Home
Yeah.
and just say, okay, I want to be seen today. No, you have to have
I remember the gold card.
the gold card to get
Yes.
in. And the reason why I know about so many of these places, training at Baylor, we trained and we know about the federally qualified. I've worked at many federally qualified clinics, helping them out, getting them started up and things like that.
And that's good. And that's good information. I know I've heard of Legacy. Legacy is huge, but I'd never heard of Avenue 360.
Yes.
So that's really
yes.
good information for people to know that don't
Yeah.
actually have insurance. Because
Hope Clinic is another one.
Hope Clinic. Okay.
Yeah, I think St. John. They have multiple federally qualified clinics here.
Here in
But
Houston.
Legacy is the biggest one.
Okay.
Yeah.
Yeah, we're trying to remove excuses as to why people are not going to be seen, for their health or whatever.
Yeah.
And I know in our community, sometimes we struggle with that, and we try to use home remedies, which some things it is good, but you still need to try to take care of your own health. So I really sincerely appreciate you coming on here today to talk to us
Yes.
about our health preventative measures and going yearly, and especially like with certain diseases, as you said, if it runs in the family, then we need to really kind of stay on top of it. I wanted to talk to you briefly, ask you about when it comes to preventative measures, because you deal with holistic,
Yes.
the body and the
yes.
soul.
Yes.
So what can we do actually when it comes to eating?
Yes.
How
Yes.
can eating help us when it comes to
Well,
maybe certain things that we
This is really big because as a physician, I'm also a minister.
right.
When I'm taking care of people, I'm trying to get to the soul root of the issue. Not just, oh, you have high blood pressure. And what is let me just give you medication. No, what's causing the stress? What's causing your blood pressure to go up? And getting to the root of the issue.
Yeah.
And so we have to always address how you eat. What are you eating? Your exercise, eating, because this is number one with prevention. Because many times diabetes is preventable.
Yeah.
Diabetes is preventable. And so once you help people and you get them on a well-balanced diet, it's a lifestyle. We don't like to say the word diet. We like to say the word lifestyle. Like I practice a plant-based diet. Sometimes I fall off, but I'm
get
really
it, yeah.
focusing on the plant-based diet. I've really been pushing the plant-based diet with patients. That means that you have to take red meat, out of your diet.
Yeah.
And so that is very challenging for our people.
It is. I had to do the Mediterranean. The doctor put me on the Mediterranean once, but I got used to it. I adjusted it, got
Yes.
adjusted to it. But
Yes.
you're looking at health long term, so I'm like, okay, I can do this. But it is an adjustment.
And I would say for our people, salt and sugar. Salt and sugar is too much. We're eating too much. And so even when you think, oh, I'm not cooking with that much salt, or I'm just putting a little bit of salt in the pot or thing, it's too much.
Yeah.
And so really my focus is to get people to cook with no salt.
Bland. Wait a minute.
Just herbs and just
Okay.
get your herbs.
Mrs.
I like
Dash.
Mrs. Dash.
Yeah.
I like Mrs. Dash because, you go now in the grocery store, there's like 30 different herbs you can
Right,
use
yeah.
with Mrs. Dash. But really getting people off the salt or having a limited amount of salt. I know they say 2 grams a day is a low salt diet. Because we're seeing the number one cause of death in this country is heart disease. Heart disease is still number one with women. And so we have to tackle the weight, the diet, walking.
I love walking.
Walking
Yes.
at least 150 minutes a week. That's our recommendation is 150 minutes a week. And not just what people say, well, I walk at work and I walk around, and it's like walking to get your heart rate up.
Yeah.
Yeah.
Cool.
Yes.
This has been really good information. And I appreciate
Thank
you
you.
stopping by to
Thank
talk to us. We're
you.
going to have to get you back to do a part
Yes.
2.
Yes.
A follow-up as to where we are with our health, including
Yes.
myself. Rita, are you walking? Yes, I am. But if you would leave a simple note with my audience, what would the simple note from Dr. Sabrina
I
be
would
today?
say you only get this body. Your body is a temple of the Holy Spirit. And you want to prioritize taking care of you by eating a well-balanced meal, taking a lot of fat, salt out of your diet, exercising, and keeping your weight at a great BMI to prevent heart disease, to prevent stroke, and to prevent diabetes.
Thank you so much. Thank you. Thank you so much for being with us.
Thank you.
Another 20 minutes of Simple Notes from Rita. Until next time, have a wonderful day and be blessed. Bye-bye.
Oh, she's taking her power back. Yeah, she's taking her